basically the severity of the illness plotted against time, and flattening it means to push it down so that all of that occurs underneath the line that's the capacity of our medical system.
Okay, so that's why it's important for us to continue the hygiene habits of washing our hands as often as possible,
right,
and consistently social distance, and now physical distancing now, right?
Correct.
I've heard the terminology change a little bit. Can you talk a little bit about social distancing and physical distance? Are they one and the same, or what's the difference?
They're intimately related.
Okay.
But social distancing tends to be more of when you go outside and hang out with people you don't know. I mean, overstating it, but that's kind of the deal.
Okay.
Social distancing is when you're in a social environment, stay away from people that you are typically not intimately related to. Now, physical distancing means what it says, physical. It's the 6 feet or more, and also 10 minutes or less, which we use for the definition of an exposure.
Okay.
So 6 feet or less, or more than 10 minutes, we say that's an exposure. So social distancing, you can kind of think of it this way: outside. Now, obviously, people inside with your family, you can't really distance from them very well. And physical distancing is the measurement 6 feet or more, or 10 minutes or less.
Okay.
And I would speak to hygiene too,
Yes,
to digress off that question.
Yes, sir, please.
It really is, what should we continue doing? I want to speak to that because we live in a very complicated world, so we look for complex solutions to things, procedures, policies, processes that are very complicated, because that's the world we live in.
Yes, sir.
But the good news on this one is, it's not to get anything complicated or anything difficult. It's to do very simple things, but be extremely conscientious in doing very simple things.
Okay.
And so it's not complexity, it's conscientiousness that we need to really emphasize for stay 6 feet away from somebody, wash your hands, do things like that we're kind of emphasizing for basic personal hygiene, basic social distancing. And it's not, well, this is really easy, it must not be that effective. Well, it is. The simplest thing is the most effective thing. So when the governor says and the mayor are saying, don't relax your vigilance, they really mean it. Is don't relax vigilance. We look upon simple things as ineffective, but they're not. For us, the simplest things are the most effective things.
Yes, sir. Yes, sir. I have one question here from one of our police officers, and the question is, once the curve starts to flattening, will COVID-19 become seasonal, considering it's projected to resurface again later this year?
A great question. I'm going to have to give that as more of a philosophical answer.
Okay.
And it'll relate to several other questions I feel confident that will be asked within our interview today. One of the things to remember about this virus is it's brand new in the human community. It's only been within human beings for about 5 months. So most questions we want to ask are extremely good questions, but the answer is we really don't have an answer. Last I checked, and I could update this if necessary, but last I checked, there are literally thousands of scientists all over the world working on what does this virus do, how does it act, and how do we fight it. And at least 6 of them are Nobel Prize winners in some field of biology, and they don't have an answer yet. So when it comes to guys like me, I'm not really sure I would have an answer of any kind. But it's a great question, but nobody really knows is the answer to it, because in many, many things about the behavior of this virus, it truly is nobody on our entire planet knows.
And I think that speaks to this rapid changing environment, right, in these unprecedented times. And there's so much information out there on social media, some misinformation and some factual information. Right. So that's why it's important for us to have dialogues like this, so we can try to get factual information out there to our community. Another question is, what can a person take to boost the immune system to fight against this virus?
A good question. It's interesting that I like the way they ask to take. We kind of live in a society where we want to be able to take something to help us out. With viruses in general, the most effective thing you can do to boost your immune response to a virus is to get adequate sleep. So I know it sounds funny, but really any study anywhere throughout the course of history in the past literally decades of science research, the most effective thing that can be done for immune system response to a virus is get adequate rest. Now, the mechanism, I'm not sure any of us know, but to go beyond adequate rest, which I do want to emphasize, the most effective thing for boosting immune system to a virus is get adequate sleep, adequate rest. Now, beyond that, yes, just personally, not necessarily professionally, I'm an advocate of taking a daily multivitamin. But other than that, there's not a lot of pills we can take or supplements we can do that are, so to speak, immune boosters. Now, I know there are things that are actually called immune boosters. We have them in some of the commercial establishments.
Yes,
you can add them into a smoothie at some places.
Mm-hmm.
They're good, but the effect you're getting out of that is literally like a single-digit percentage boost. Now, it's probably worth the effort if it's not that expensive, but think about it. The most effective thing to boost immune response to a virus is get adequate rest, and that's totally within the control of the individual.
Okay. Good response. So a lot of these questions, like I say, come from our police officers and some just on social media that they're asking for clarification on. Has the annual flu shot been considered as a possible catalyst for the virus severity?
A good question. That's one I'd have to say I don't think anybody really knows. And there's a good reason for that. Again, the virus has only been present in human beings for about 5 months. To do a study like that would literally take months, if not years, to be able to get a correlation between those and really show that it's actually causally related. As far as I've seen and as far as I know, to me, there's been no study done to see a correlation between the annual flu shot and whether it has any effect, good or bad, on your response to the COVID virus.
Okay. Next question, doctor. Some cases have been identified where the patient displayed no fever prior to diagnosis. Other than taking temperatures on people entering facilities or employees reporting for duty, is there anything else we should be doing?
Yeah, good question. There are some cases, not many, where there was no fever reported. Again, remember, we are considering a fever to be 100.4 or greater to be fever. So anything less than that, we're not defining that as a fever.
Okay.
So 100.4 or higher is a fever. But to answer the question directly, yes, there are other things you can be asking for, like at the screening and the entry of a building. And there are 2 other questions to ask. So it's fever, and then the other 2 are shortness of breath or a cough that's new or changed. So if a person has a chronic cough, like a lot of people have emphysema and they cough all the time, is it new or did it change? New cough or changed cough or shortness of breath. Those are the other symptoms that are associated with this virus in its initial stages. So fever, and then any of the following 2, new cough or changed cough or shortness of breath.
Well, let me tell you, that was the question, but obviously you did a good job. We hired our trainees. We canceled our training academy, but we hired those officers, our future police officers, and you guys trained them on how to do those screenings.
Oh.
And every time we come to work, we get screened by our future police officers. And as you can see here, I didn't have a temperature today, and I didn't demonstrate any of the symptoms that you talked about. Right?
Me either, Faith. Got my
That's right. Good. Listen, if you have any questions that you would like Dr. Godby to answer, please send us your questions, and we'll try to address them. We have a list here, but we'll definitely try to get to you before we conclude today. Okay. I have a question. This is from a Garrett Tingle. How you doing there, Garrett? Any idea of how much of the population that are immune to the virus?
That's an excellent question. But the reason it's such a great question is because nobody knows yet. It's a great question. This virus is similar to other coronaviruses, of which there are literally thousands, if not millions. But the idea of immunity is something that takes place after an exposure. So with, again, going back to, it's only been present in humans about 5 months. So to determine immunity takes a fairly long process of the patient has to be exposed to the virus, recuperate from the viral illness, show that they've developed antibodies, and then be re-exposed to the virus, and then show that the antibodies were the actual reason the patient did not get a second case of the virus. I know that's fairly long and complicated, but it's long and it's complicated. So as of yet, no one has done a study on that to look at, well, did the person develop an immunity? And then beyond that, with all the detailed microbiology that's in with it, the next question would be is, if the person does indeed develop immunity at all, which again we have not determined yet, what is the strength of the immunity and what is the length of the immunity? My examples I always throw back into these interviews is measles, mumps, and chickenpox. Well, they're real easy. Once a kid gets measles, mumps, and chickenpox, which was common in my generation of years ago, it is a 100% immunity, almost like 99 point something percent immunity, meaning it's almost guaranteed. And two, it's a lifelong immunity. Well, we know that because we've had literally hundreds of millions, if not billions, of children throughout history that got the disease, measles, mumps, chickenpox, got exposed again, had the antibodies, got shown the antibodies were the reason that they didn't get it a second time with all the long complexity. Well, you can see with that much complexity, no one's really looked at that yet because there haven't been that many people worldwide that have even had the disease, recovered from it, and then we try to determine did they develop antibodies, and just because they have antibodies doesn't mean there's absolutely an immune response.
Yeah, please go to our Facebook page and invite your friends on Facebook to like and share as we continue our conversation with Dr. Godby. Dr. Godby, one of the things that we hear from our employees is, there's a lot of fear, there's a lot of anxiety that goes on, and we have family members at home who have a genuine fear or concern that their loved one who's out there protecting us could potentially get exposed while working and bring that home. I have a question here from one of our officers. Now that more has been learned about COVID-19, have we redefined secondary exposure possibilities? I know you kind of touched on that. And the second part of that question is, if an immediate family member within the same household tests positive, should we presume our employee has been infected before the onset of symptoms?
Two very good questions. The answer to the first one is no. We have not redefined a secondary exposure, meaning as of today, there is no such thing as a secondary exposure. And secondary meaning this person has the virus and is shown to have had a positive test to the virus. This person comes along, has an exposure to them, and they don't know their status yet. Well, this person does not pass it on to other people as of yet. It takes requirement of a test that has been done in a chemical laboratory to show they actually have the virus in their system. That's a positive test. So without direct contact with a person who has had a positive lab test showing they're positive for the virus, there's not a secondary exposure. So the next question is a very good one. I'm asked that all the time about family members. So within the context of there is no secondary exposure defined by anybody yet, the good question is most people when they say family member, they mean their younger children. And I'll give a little bit of the demographics on it to kind of put this in perspective. This disease has what we call a 50-30-20 distribution. About 50% of people who get exposed to it and develop the disease will have either no symptoms or symptoms that are so minor they attribute it to something else. Something as common and mundane as, it's just my seasonal allergies acting up. That's about as bad as they're going to get it. And that's about 50% of the population. The next 30% is people who are going to get the disease and have symptoms, and the worst they're going to have is they will lose 3 to 5 days of work, and they'll describe their experience as, oh my God, that was the worst cold I've ever had, or oh my God, that was the worst case of the flu I ever had in my life. And yes, they'll be miserable for 3 to 5 days, but in about a week, they're right back to work doing what they always did before. So that 80% of people is not who we're really trying to target with all of our social distancings and prevention procedures. It's that last 20% that we're really worried about. The last 20% is the people we keep hearing about with over 60 or they have pre-existing illnesses. That's the people we're trying to protect. So it's not the callous response to say, well, we're not trying to protect you and me.
Right.
Well, we are. We're trying to protect you and me because we do care about you and me, but who we really worried about is that 20%, and that 20% getting the disease from you and me. And so we will be the ones who have the minimum symptoms, or at worst, 3 to 5 days of loss of work, and then we'll go back to work a week later. So with that population of the 80%, what we're really concerned about is the economic impact. And that relates again to flattening the curve.
Yes, sir.
If everybody in that 80%, well, 80% of our workforce got sick about at the same time, and they all missed 3 to 5 days of work, well, it's not a big problem if everybody misses 3 to 5 days of work if we spread it out over a year. But if everybody misses 3 to 5 days of work in the same week, half our workforce doesn't come to work for a week. That's the big impact the 80% has. But it's the 20% that are people that end up in the hospital, on oxygen, in the ICU, on ventilators, and have the really bad outcomes. That's who we're trying to protect. So back to the original question, when your guys are asking about taking it home to their family, typically what they're meaning is taking it home to their children. Well, the good news is your children are going to do a whole lot better with it than you and I do. Mm-hmm. So I kind of give it as sort of a joke, but I'm not being completely facetious to say to guys, if you get the disease, your teenage children will be taking care of you because they're going to do a whole lot better with it than you do.
Yes, sir. Yes, sir. Well, one of the questions we had, and I saw it on social media, why is it important for us to practice the social distance measures with our older population, our elderly population, our seniors?
They're in the 20%. Okay. And that's the people we're really trying to do the most to protect. Yes, we're trying to protect you and me in the 80%, but the 20% is the people over 60 or who have pre-existing illnesses. And that's a great question. That's what we're doing to try to protect us so that we don't infect them.
Okay. One of the questions, has the 6-foot social distance recommendation been extended? Some sources state that 6 feet may not be enough distance to prevent transmission.
Direct answer, no. It has not been extended yet. There are people who are speculating that the droplet transmission, that is the presumed method of how this virus transmits itself, only goes about 6 feet. That's correct. It only goes about 6 feet. In reality, the droplets we expel when we either sneeze or cough or spit, they really only go about 3 feet, but they have been known to go as much as 6 feet. So we just say 6 feet to be absolutely certain. But no one has extended officially the 6-foot radius to stay away from people for social distancing. There are others who are saying, well, speculatively, if the virus is airborne and if the virus, everything is preceded by an if that we don't know yet. So we're saying we don't know that yet, so we're not going to act upon it because it's extremely speculative and not known, and there's not limited data to say if the virus behaves this way, then we need to do something different. Well, we haven't shown the virus behaves any different way yet.
As a follow-up question to the one when we talk about our vulnerable population, the question is, we hear pre-existing conditions create a bigger risk for those that contract COVID-19. Which ones are the biggest risk factors, and why do these conditions create additional risk? How do we help mitigate those risks for people that have these coexisting conditions?
Great questions. I'll try to remember all three of them. The pre-existing conditions, they will vary a little bit in the order depending on what population, but in the top several that I can remember, number one pretty much universally is hypertension. High blood pressure tends to be top of the list. Second underneath that is diabetes. So those two typically stay top two no matter what population we're looking at. The rest of them vary a little bit, but the others are like kidney disease and lung disease, meaning chronic obstructive pulmonary disease or emphysema. And then one of the biggies, particularly for us here in Louisiana, is obesity. We tend to be the most obese state in the United States because all the food here is so incredibly good. But obesity is one of them. Now, the mechanism of how each of those contributes to the disease process and why it's such a risk, a little outside of my area of expertise. I would have to look it up, and one day we can get back with that if somebody has a publication or some speculation on it yet. But those, I don't actually know the physiologic or the pathophysiology of how those conditions specifically relate to the bad outcomes. Right now it's just a correlation.
Good response. We're going to take a couple of Facebook questions. Sure. We have one from Gwen. Hello, Gwen. How you doing? Thank you for your question. Gwen's question is, what PPE is provided to our police who have direct contact with the public while on patrol? I think I can take that one. Gwen, we keep up with the PPE that we receive from MOSEP that comes through GOSEP, and we also get donations in from the public. So I can tell you, I have a report here. We've received 5,670 KN95 masks. Of those, 2,296 have been issued throughout the department. We received 11,500 surgical masks. Of those, 4,595 have been issued. We've received about 959 safety glasses. Of those, 382 have been issued to the department. We received 930 Tyvek suits. These are suits that you can put on and then dispose of after usage. and we've issued about 413 of those. We received 17,239 gloves. Of those gloves, 8,300 have been issued to employees throughout the department. We've received thermometers where we're actually testing individuals at all of our sites, not only here at the police department in our districts, but also at other city sites where employees are coming in to test them and screen them prior to entering. 120 gallons of bleach have came in. We've had Clorox wipes, 333 Lysol cans, 244. Hand sanitizer, over 1,087 bottles. And we still have more coming in. In fact, I was on a conference call with the mayor's office today where we have several donations that are going to be coming in. So we are doing a better job of getting that PP out. Thank you for your question, Gwen. The next question, let's see. Okay, let's see. If the stay-at-home order, this is from Brandon. How you doing, Brandon? Thank you for your question, Brandon Clark. Brandon's question is, if the stay-at-home order doesn't get taken seriously, will there be any enforcement implementation? Brandon, we hope we don't have to get there. That obviously is something that we can do, but we've been fortunate in East Baton Rouge, particularly in the city of Baton Rouge. We have a special group, a team. It's Baton Rouge police officers, ABC, as well as the fire. So we look at businesses if we get a complaint. And when we receive reports from the community that there isn't compliance in social gatherings. Today, as of today, I can tell you that those persons that we have come in contact with and have those discussions, they've now complied. So we haven't had to resort to enforcement action. So we've been fortunate that our community has been taking it seriously. And when we have those one-on-one, heart-to-heart conversations about their responsibility as responsible business owners and responsible residents, they have been compliant in the city of Baton Rouge. So thank you for your question. I have one more question here about, can you kind of give us an update on currently 75% of ICU beds in Region 2 are being used. What plans are being made since that number doesn't seem to be dropping, or do we see any drops in that?
That one I'm going to have to say I don't know.
Okay.
I'll have to ask the emergency planners on that one. Great question, but that one I don't know.
Okay. I have one more question. So blood, I got this from a couple of our officers.
Okay.
Based on your blood type, are you predisposed to test positive or to recover quicker based on your blood type?
That's a great question, and the answer to that one is nobody knows yet.
Okay.
There does seem to be some level of correlation with people who have type A blood and severity of their symptoms, but there's also some level of correlation with people who have type O blood and less severe symptoms. But those studies were done in people in ICUs that were already on the most severe end of the train.
That's right.
So it could just be that those are people who had other pre-existing conditions that were contributing to it, and they just happened to have that type blood and it correlated with their symptoms. Also, there's no control for the fact that of this very limited population of people who were in ICUs that were having these studies done on them with relating to blood type, you don't know if it could be something to the effect of, and I'm kind of making this up just for illustrative purposes, it could be that, well, yeah, A-type blood has more severe symptoms, but it could be that it's more difficult for them to contract the virus, but if they do get it, they get it worse. Whereas O-type blood may have not as bad as symptoms, but it's easier for them to get the virus because you're looking at what's happening in an ICU, and it just may be that people with A-type blood stay a lot longer, so there are just a lot more of them. People with O-type blood don't stay as long. Again, there's a lot of confounding variables. So blood type is not anything that anybody has shown has any level of correlation with severity of outcome or severity of symptoms or their propensity to contract the virus. It's all purely theoretical.
Well, Dr. Godby, thank you for your time. There's a few questions here that we were not able to get to, but I want to be respectful of your time. We have to stay on time. But here's what you can do. There's going to be a town hall meeting on Thursday at 11 o'clock a.m. for first responders. Some of the questions that we're not going to answer here, we're going to direct those questions. It's my understanding we have a town hall meeting with you and our mayor president.
Correct.
Where we're going to be taking questions from first responders. That number is 415-655-0001. That's 415-655-0001. Access code 284-223-649. One more time, 415-655-0001. Access code 284-223-649. Follow us on social media. You can go to the Baton Rouge Police Department social media accounts as well, and we will also provide that information. Dr. Godby, thank you for your time and thank you for your leadership. We know this is a rapid changing environment, but we're going to get these other questions to you. And to those in the community, continue social distancing. Continue being that responsible family member and that responsible community resident. Look, we're not there yet. We still have work to go. We're seeing some signs that we're starting to flatten that curve. Is that right, Dr. Godby?
Correct.
But we have a lot of work to do. Keep listening to the directives that have been issued by our governor, by our mayor, and God bless you. Thank you.